He's known for this idea of resilience, which I'm sure he'll talk about. He's a professor of clinical psychology at Columbia, and I'm sure we probably even have some of his books up in the foyer here. Anyway, I know he'll talk about this idea of resilience that maybe flies in the face of some of the things you might have read in magazines and newspapers on this idea of trauma and these, as you would call them, potentially traumatic events. But without further ado, Dr. Bonanno.
Can you all hear me okay? Okay, great. So this talk is a bit of a departure for me. I am a researcher. I spend a lot of time with data. I like data a lot. I like empirical tests. And I've been fairly critical about just about anything. And I'm critical about most, when I say critical, I mean critical look at things. I've always taken a critical look at meaning literature, somewhat from outside. And initially when Paul asked me to speak, I think I said something like, it took a long time. But then he said, no, the right guy. And I want you to talk about your work. Which I took as a really nice invitation, and I'm very glad I came. I'm delighted to meet many of you for the first time. So in preparing for this talk, I took a good hard look at the literature for the first time in a few years, and tried to make sense of it. No pun intended, and to integrate it with some things I'm doing recently on flexibility and also resilience. So I've rewritten this talk now 4 times than I should have probably. Even this morning I decided to rewrite it again. It's a new talk for me, and it's kind of a new set of ideas, so it's going to be a little bumpy. I don't expect you to agree with everything I say, which is just fine. I don't ever take this stuff personally. You could even say nasty things. I won't take it personally. But I sincerely hope that some of this is useful. So I begin most talks with the same slide and the same basic idea, because it's basic common sense. That bad things happen. During the course of a normal lifespan, almost everybody must endure the death of loved ones. And most everybody is exposed to one, at least several violent or life-threatening events. Actually, the epidemiological data and some other kind of ecological military assessment data suggests that most of us are exposed to multiple potentially traumatic events during the course of our lives. And we sometimes forget that because we assume these are very rare things that happen to other people, but they happen to all of us. And they can be debilitating and distressing. So these are images you can see almost any day if you pick up the newspaper, turn on television, go to the internet. And the idea when we see images like this of making sense of finding meaning, of course, looms very large, because these events kind of beg for some explanation, some meaning. And sometimes that can be a little bit blinding. So what I'd like to do today is to pose 5 questions, which I will try to answer. Is meaning making necessary and adaptive? Does meaning making change over time? Is meaning making the same for everybody? Does the type of event matter? What about other risk and resilience factors besides meaning making? And finally, I will introduce the concept of psychological flexibility and try to integrate some of that, at least part of an answer. We're not even close to answering these questions in a full way, but I'll tell you what assessment I can make of them. So is meaning making necessary and adaptive? This paper by Crystal Park, I think, is the most comprehensive and the most elaborate review we've ever had on the topic. It's a wonderful paper published in Psych Bulletin in 2010. It's a large paper. And she really takes the question to heart, really does a good job of it. I was sitting on a pier in Baltimore, I think, in a conference, having lunch next to a boat, where the things are, piers. And Crystal said, I reviewed the entire meeting in literature. And I kind of, my eyes widened. And she said, but I lost it. It was on her computer, and her computer died. She lost the entire thing. And I think I choked. And I said, you have to get that back. And she said, it's gone. So she actually redid it. Started from scratch and redid the entire review. and then published it in his paper. This is really a landmark paper because it really looks at all the literature. It's really, I think, the most comprehensive today. But is meaning making necessary and adaptive? The available empirical evidence, which Paul Wong has talked about for a long time, is decidedly mixed. Some positive findings, some negative findings, some studies that show no relationship. But what's interesting about that is it's the same story. The different aspects of meaning making, whether you're looking at processing, searching for meaning, working through self-analysis, sense-making, positive reappraisals, all these things we measure. It's true with longitudinal and cross-sectional designs. It's true whether it's self-report or narrative. I just reviewed, there's a special issue in the journal Memory on narrative analysis and meaning making, and I just reviewed all those papers to write commentary on it. The same stories in those papers as well. So across multiple methods and measures, the answer is often yes, but sometimes no. Does meaning making change over time? Almost certainly. And here we can think about the point Crystal made, meaning making versus meanings made. So really meanings made is a really interesting question, but when is meaning best made? Well, that's an interesting question. What about in the first hours after a potentially traumatic event? Bob Nehmeyer today told us a very, very gripping story about a woman whose son died in a horrible way in a car accident. The meaning can be made in that time. Is that we need to think about that a little bit. The event is salient and compelling. Meaning making is perhaps imperative at that time. But we're also most disturbed, disequilibrated. We're preoccupied with coping, more with coping than we are with explanation. This is one of my favorite little images. This is from a paper by Tony Visconti, Bergman, and Volker, published in 2006. And they talked about stress reactivity like a pendulum with friction. So you have, and the implication here is that stress reactivity is never, we're never static, we're constantly in flux. So we're in and out of states, our well-being, our affect goes up and down. We're not in a static state. And so we're oscillating all the time. And this is really true if you Google any kind of bodily systems, nothing is static. But when something really aversive happens, it slams that pendulum to much further swings. So rather than just becoming all bad, what happens is the pendulum is now swinging widely in and out of states, even back to positive states, benign states, and back to negative. So it's really this disequilibration that happens. Then we have something like cortisol, which is actually just the most amazing stuff. My children are teasing me regularly about my cortisol obsession. So cortisol, when there's a significant stressor, the amygdala is saying, danger, 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 and the signal travels to the hypothalamus, the signal's pituitary, whatever those are called, pituitary releasing hormone, I think, which travels to the pituitary sends ACHT into the bloodstream, to the adrenal glands, about the kidneys, and they send glucocorticoids into the bloodstream, and that travels back to the brain. That all takes usually around 20 minutes to travel that route. It goes right to the brain because it can go right to the blood-brain barrier. And what cortisol does is it ramps up the stress response. So all the things that are already going on in the brain are now super enhanced by cortisol. But it also does something fascinating. It limits memory, retrieval, and elaboration. So this is how memory would normally work. We have an event, and the details of the event go into working memory. We kind of rehearse them. They get thought about a little bit, and then we deposit something or we store something in long-term memory from that event. But soon afterwards, 5 minutes, 2 minutes, an hour later, we might retrieve that event, think about it again, and then we think about it more, we rehearse it again, we might add some associations, and we store that event. And then we might remember the event again, soon afterwards, retrieve it again, think about it, store it, reconstruct it, add new information to it. And this goes on and on and on. And we gradually elaborate on the event with all kinds of associations. And we have a wonderfully rich memory now that's connected to lots of stuff in our long-term memory. And this happens routinely when there's a significant event. You think about one of the talks you saw earlier today, the very poignant pictures that, or sound bites that Bob Nehmeyer presented to us, really poignant stuff. You think about it each time, we're going to add things to that memory. When cortisol is in your system, though, a lot of that is severely limited. So, say a serious traumatic event, a potential traumatic event happens, rehearsing it and working it, and you deposit something into long-term memory. 2 or 3 minutes later, the retrieval is blocked by cortisol. So you're not able to quite pull that back. You're not dragging associations from long-term memory up. And you're not rehearsing it anymore. So what happens is you get kind of a very weak associative memory. And that's wonderfully adaptive, because what that does is it keeps us from having these behemoth memories of these events. We get the images, we got something, we got what we need to know, but we're not going to do a lot of processing. We can do that later when the cortisol is off and we're no longer in danger. So it's an adaptive mechanism. But it also means we're not probably going to do a lot of processing at the time. So what about soon after, so the time after the event? Cortisol effects typically abate several hours after a stressor. So stress response damages, we kind of return to normal. Now we're in a very good position to think about what just happened to us, process it a little bit, kind of take stock. What the hell was that? Or gosh, how am I going to deal with it? Or this can't be true, this is the worst thing. Now we start asking those questions. We talk to other people also. And social sharing and talking with other people is a huge way that us humans understand the world. Social sharing is highest within the first week after most any life event. Bernard Rimet, a wonderful researcher in Belgium, has made this point. They continually do wonderful stuff. For example, following the 3/11 terrorist attack in Madrid, they showed that social sharing in that first week predicted lots of good stuff later on. Social integration, growth, sense of acceptance, and well-being. The level of social sharing in that first week predicted those things. So, the first few weeks after that initial stress reaction wears off is really an optimal time for making meaning, but there's also a lot of variability there as well. This is from the same Visconti paper I mentioned, and I love this figure as well. They measure well-being every day in the first 100 days, and what I've done here is I've plotted the average across those daily measurements. They talked about a resilient person and a person with chronic distress. And they reference specifically the trajectory of mine. So these are the same kind of trajectories I talked about, although the resilient group is high because they have high well-being. If you put the daily ratings on top, this is what you see. Tremendous variability. You can see in the first 3 weeks or so, these two groups are really in sync. They're both all over the place. And in this group, the resilient group gradually, they still have some swings and they gradually settle down, whereas this group, the disequilibrium will continue. But this really suggests even when people are basically okay, they're still disequilibrated for a while. They're still in flux, so meaning making is going to be hard then as well. What about later, months after the event? Well, greater distance from the event allows for reflection and more elaborate meaning making. This is definitely true, obvious, but only if the event is no longer intensely distressing. If distress persists or reflection is prolonged, the search for meaning can easily become rumination. Now, I know Susan Al-Naxama has got a fairly nuanced view of rumination, so this is a kind of oversimplification. The rumination essentially is an unhealthy kind of obsession or continually turning of an event. And rumination is always linked to exacerbation of psychopathology. Sometimes the opposite happens. Sometimes we simply stop thinking about the events, especially if the event is past, we're kind of understood what we want to understand from it or what can be understood. Often people just simply stop remembering the details of these events. And this really fascinates me. This was a study we did of Columbia undergraduates. We followed them for 4 years. Every week they went online. We did lots of things with this study, but every week they went online and they checked off any of the events that happened during that week. There were 50-some items, 53 items on this checklist. There were potentially traumatic events, academic financial stressors, family stressors. There were positive events as well. And when you do this kind of data, you find a whole lot more exposure to potential trauma. I don't think Columbia is delighted by these findings, but the average number of potential traumatic events for these 4 years was 6 for these students. Now, New York, it's not Canada, right? So things do happen with a greater frequency in New York. But New York's, I'm raising my kids in New York. I'm not too worried about it. I don't think these results are from New York. I think this is just what happens in life. We asked then people at the end of those 4 years, okay, you did this for 4 years. Now, here's the same sheet, the same response sheet. Now tell us what you reported. Remember what happened over those 4 years. And it turned out that people actually remember a little bit more on average. But if we looked at for individual variation, it turned out that 2/3 of the subjects under-remembered. 22% over-remembered, and there's some people who remembered about the same. But most people under-remembered even potential traumatic events. You can see people under-remembered all kinds of events. They under-remembered potential trauma slightly less, but they still under-remembered. We tend not to think that happens, but people do forget about pretty bad things that happen. This was a study we did with people who were in or near the World Trade Center. For anybody who was in the workshop I did yesterday, we showed some videotapes from that study, and this is the same data from the same study. So these were people who were in or near the World Trade Center, high exposure survivors, and we tested their memory at 6 and 14 months. So this was objective disclosure. We did this with both their narrative, we coded the narrative, and we also gave them a questionnaire about all the things that happened. I'm going to show you the questionnaire data here, because in a way the questionnaire data is even more impressive, because it's not about them talking differently. They're really answering the questionnaire differently. What we did find was, we looked at objective disclosure. Where were you when this happened? What happened? All these are objective details. It turned out that the people who had chronic PTSD, they had more changes in their memory reports from 6 to 14 months. But it was random. It went, sometimes it went up, sometimes it went down. So they were just having a hard time remembering the details, probably because of psychopathology. But when we looked at subjective exposure, memory for how distressed were you, how upset were you, all the subjective aspects of what was going on at the time, it turned out that the people who were resilient or recovered, they under-remembered. They downgraded the stress. They remembered it being less stressful than it actually was. So they significantly downgraded the stress in the report. And they made significantly more omissions. Endorsing something the first time and not endorsing it at all the second time. So they were really leaving out a lot of stuff in their memory of the events. And these are the people who were essentially doing really well. So this seems to be a normal part of what health is. And you just stop, you lose some of the details of the Is meaning making the same for everyone? This is a large area of my research, so I'll spend a little bit more time here. I just took a picture of my foot by trying to check it. So I'll talk about individual differences in response to stressors. This is a common way I like to present these data where we have a potentially traumatic event, and then a continuum of time, and then also a continuum of functioning, in this case, dysfunction. And after 20 years or so doing this kind of research, these are the basic patterns we've seen now over and over. I'll walk through this very quickly. So 5 to 30% of the population exposed to all kinds of adverse events will show chronically elevated psychopathology. I've argued fairly ardently now that that's really the upper threshold. It doesn't get much worse than that. Some people show this recovery pattern, where they get better over time after a struggle. Some people show delayed reactions, or Bob Naiman offered a really nice name for this, of deterioration instead of delayed. And also the resilience pattern. You can see here that the resilience pattern is the most common pattern across all of these studies. Resilience, or this relatively minimal impact of a stressor on the functioning, is between 1/3 and 2/3 across all kinds of events. Some of the really nasty events. We just did a study of spinal cord injury and resilience. This pattern is showing close to 60% of the people with spinal cord injury. So it's the modal response, the most common response. Sometimes people get better after something really lousy happens. I'll show you some data to illustrate that. And then sometimes people are just doing poorly all the time. And they might identify the stressor as a source of their poor health, but they were doing poorly often before. So there's usually a subset we can identify. This was a very important study in the progression of this research, because it was a bereavement study, and it was the first really great, really nice prospective bereavement study. This study was the branch out of Camille Warpin, Ron Kessler, Jim House at the University of Michigan. And they followed 1,500 married individuals in the Detroit area for about 7 years. During the course, and I got interested in this study, so this part of the part I worked on with them. During the course of the 7 years, 205 people lost a spouse and had been interviewed on average 3 years before and twice after bereavement. This was really important because we've been writing about resilience at the time. And the common response in the bereavement literature was those people are either didn't really care about the person they lost, or they're cold and unfeeling, or they have lousy relationships. There's some reason why they would be not showing that kind of grief. So we thought we can really answer this question here. So we identified that group in this sample. This is a very crude way we did it in the early days of this. We did this mechanically. We sort of 45% of the sample had no resilience of any kind of a study. Last year, Isaac Galatzer, Levy, and I reanalyzed these data using late growth mixture modeling, which is a really nice, sophisticated modeling program that essentially empirically finds where the trajectories are. We're doing a lot of work with this method now. But this approach replicated the earlier approach. So the same basic pattern, but it suggested that the resilient group was 66%, so we found a higher percentage of resilient people. They were not unhealthy in any of the pre-loss measures. There was nothing wrong with these people. They had actually been interviewed. The interviewers rated them. They did not find them cold and feeling. They did not find them socially inept or they didn't care about other people. And their marriages were in the normal range. They weren't exceptional, they weren't terrible. They were just in the normal range. Importantly, before the loss, they scored high on two really interesting variables. Belief in a just world, said that the world is a fair place, and acceptance of death. So they would said things like, that happens, you just have to live with it, and I can accept that. And that in turn, these are the people that ended up being resilient. After the loss, they were the lowest, or during bereavement, they were the lowest in searching for meaning. They reported the fewest number of regrets about the relationship. And they scored highest on comfort from positive memories of the deceased. I, again, harken this back to something that Bob Nehmeyer said. I'm now officially in Bob Nehmeyer fan club. But I've been in the fan club a long time. He's never come out. Bob talked about this the other day, and that these people were able to contemplate the memory of the person they lost and comfort themselves. We also then saw this pattern. This is the first time we saw this pattern. We've now seen it in 4 other studies. This group was depressed, highly depressed prior to the spouse's death, and after the death, they were no longer depressed. And they stayed in healthy range for the rest of the study for the full 7 years, for 4 more years afterwards. We've now seen this in several other studies, and it's the same common pattern. Prior to the loss, they had an ill spouse. Often there's caregiving, they weren't necessarily caregiving in this study, but they didn't get along particularly well with that spouse. They had an ill spouse and they didn't get along with. That sounds like right out of John Paul Sartre. They were introspective and emotionally unstable. They had lowest levels of interpersonal support. But they also scored high on a scale we made for the study called personal justice. The world was fair, but not for them. Everybody gets the break. This really sucks what I'm going through. After the loss, though, all the depression went away. They scored lowest on searching for meaning, lowest on thinking about the loss. But they were talking about the loss, at least. They saw the greatest benefits or growth from the experience. And they also were able to conjure comforting memories of the deceased, but it took them a while. They couldn't do that until 18 months. So it took them a while to kind of just readjust the whole thing. Just to show you how these trajectories work, I don't have time to go into this in any great detail because I want to cover a lot of other things. But this is just some of the other kinds of studies we do. This is something called the German panel data set. The German government collects data on a sample of their citizens or representative samples of the population-based sample. And in this particular study, they followed about 17,000 people for 19 years. And they're doing this all the time, it's ongoing. This paper was published in the Economic Journal by Andrew Clark at the Paris School of Economics and Ed Diener, who's a psychologist in Illinois. And they looked at life satisfaction and how it varied in relation to these different events: unemployment, layoff, marriage, divorce, death, responsibility for the child. So we reanalyzed these data, because averages don't, I argue with them. I have time to talk about this in the workshop. Averages don't tell you anything. Averages are often misleading because the individual patterns they mask. And you can see it here. Here, the average widowhood looks like this. So people are moving along the year before the spouse dies, life satisfaction begins to drop. It reaches the lowest point the year the spouse dies, then it gradually goes back up. When we analyze those data with mixture modeling, though, the same way we do the other studies, you can see that most people are hardly affected at all. And we think of the average as the normal response, but it's not the normal response. The most common response is this resilient response. Now we're talking about life satisfaction levels are high. We did see some of the other patterns as well. Now this, just to illustrate this is divorce. I love this finding. This is published in the Economic Journal. This is a serious journal. If you're married, what does this tell you? Don't lose any more time. Go out and get divorced right now. It takes a couple of years, but then it starts to go up. Your life satisfaction starts to go up. There are lots of people who would say that this is, a common kind of idea. This is a real photo. This was an ad of law firm. We're a capitalist world. When we looked at the mixture modeling, though, this is what we found. 9% of the sample did show this pattern. They did, their life satisfaction actually started to creep up before the divorce, probably because they realized they were going into divorce. So 9% of the sample, their life satisfaction went up. They got out of bed quicker. 19% got worse. Now these are the two groups you hear about. Best thing ever did, getting divorced. Don't ever get divorced. Those are the two things that you hear about. But there's still a lot of people, 71.8% of the people in the study showed no change in their life satisfaction before and after the divorce. Now this is really striking. I wouldn't have even predicted this. I didn't know much about divorce when I did the study, but I would be able to predict that. And the reason I wanted you to see this slide is because it suggests that that we really can't assume what people's experiences are for any of the events that we might want to talk with them about. We can't really assume what their needs are in terms of meaning making and growth. Now we didn't measure anything about meaning making in the study, but there are a lot of implications. Does the type of event matter? Different events do produce slightly different frequencies of these trajectories. We see the same trajectories along many different types of events, which I'll show you in a minute. Oh, I'll show you right now. These are a lot of the different studies we've done. Bereavement studies, terrorist attacks, SARS, the SARS epidemic, we did this in Hong Kong. Traumatic injury, very serious study, breast cancer surgery, hereditary cancer testing, job loss, divorce, birth of a child, combat deployment, and spinal cord lesion. These are some of the studies. Across all of these studies, the resilient group was always the most common, and often the majority, but not always. But it was always the most common pattern. And there was always a chronic pattern that was in the minority, and there were the other trajectories as well. But you can see the percentages vary considerably, but the proportions are within a kind of a range, but they vary considerably. So it does suggest that different events are going to result in different profiles. The profiles, I think, are fairly realistic. I think I would go as far as to say they're in nature. But then we have this really interesting question about isolated potential traumatic events versus chronic stressors. And I'm only coming to understand this recently. I was talking with Paul Wong about this, and I've had some fairly difficult conceptual arguments, which is a nice way to say it. I've been fighting with developmental researchers for a while about this question. And I think I finally now have an understanding of it. When we're talking about an isolated potentially traumatic event, we're talking about an event in otherwise normal circumstances. Bam, this event happens. And people can be resilient and show this pattern of really minimal impact. So now, I think now it's time to start getting a little more nuanced with this. And I'm calling that the minimal impact resilience pattern. It describes a pattern of minimal impact, of not really, no lasting emotional or psychological upheaval. However, when somebody's confronted with a chronically stressful situation, poverty, just a long-standing thing, torture, long military deployment, a long abusive relationship, or any other kind of enduring difficult event. For example, we just completed a study with Stephen Halpern on Palestinians in the West Bank and Gaza Strip. And the amount of exposure in that group was shocking. And it's a population-based study, but we started measuring what they've been through. It just kept adding up to this enormous amount. When you're in that situation, you don't expect to find flat line with no impact. And we didn't find that flat line. It's really got me thinking about this. Instead, you see something like this, which I'm now calling emergent resilience, where the person, while this long struggle is going on, there's all kinds of upheaval. Our bodies are in high stress mode, and when that's happening, you're not going to be free of any difficulties. Stress takes a cost. But when the situation abates and lessens, then people can kind of gradually pull back to the normal range, and that's a kind of resilience too. So we're calling that emergent resilience now. And those two things I'm putting up side by side, you can see have really different qualitative, phenomenological properties, but they will evoke different kinds of meaning. Kate McLean has been arguing that people with particularly challenging lives may not find meaning or may experience little benefit in meaning making. And there was recently a paper that came to my attention by Sales and colleagues out of the lab of Flybush. They do a lot of this kind of interesting work with narratives and aversive events. They looked at a sample of adolescent females with a long history of trauma exposure. And they did an analysis of worst event narratives, and they found very little meaning making in all of those narratives. The narrative variables that had meaning making were associated with greater depression. And they concluded that for individuals who have not experienced challenging lives, it might be healthier not to reason about their past lives. They may be more adaptable to simply move forward and assume one can change the future rather than try to make sense of the past, and they simply be senseless. What about other risk and resilience factors? Might other factors make a difference? Will they make meaning making more important or perhaps less important? When we look at the predictors of resilient outcomes, using multivariate modeling, what we find there are multiple unique predictors. This is a kind of a summary of, this was a paper we did for psychological science in the public interest on disaster. And this is adapted from that. But it basically, these are all independent predictors that are modeled in a multivariate way. And when you do that, you end up with a lot of factors that explain, each one explains a very little portion of the variance. So no factor explains a lot of the outcome. No one factor explains much of the variance. If we slice it up like a pie, each one is like that blueberry thing with the strawberries on it that was in the restaurant. Anyone eat that? Tiny little sliver slices. They're good sliver slices, and these are all very nice predictor variables. But they're only explaining a small portion. Personality, which we love, only explains a small portion of the variance. So that's both good news, because it means it's a complicated picture and there's a lot to work with. But it also means when you think about something like meaning making, it's not the only thing that's going on in people's lives. And whether it is useful or not, or present or absent, is moderated by a whole bunch of other factors. And that's really something we need to start thinking about. So to summarize at this point, before I move on to flexibility, I'm talking about a lot of these different things. Form, the timing, the experience of distress, the type of event, the duration of event, other risk and resilience factors, personality, the social context, etc., things I didn't mention. All of these things explain to some extent whether meaning making is adaptive or not, what it is, how it works, when to do it, etc. And the way we can start to integrate these things, I think, is what I'm trying to work out through today, is through the concept of flexibility. Now, I have to give my daughter her little asterisk here. She taught me how to do that. She's she kind of rolled her eyes and said, "No, you do it like this." So she gets a little asterisk. So what is flexibility? This is the background of it. Traditionally, we tend to think about coping and emotion regulation, these other variables, in terms of good and bad strategies, the best and worst. That's actually not how leftists and folk first started talking about coping. They didn't intend that at all. They had a much more dynamic conception. But it kind of got, you create a questionnaire in research using it. We start thinking, this is good, this is bad, right? And so this kind of evolved. So support-seeking expression, meaning-making, all these things are supposed to be good. and denial, suppression, avoidance. These are bad. Right? So this is how we kind of slipped in thinking. But if you think about different aversive situations, they present with very different challenges. Terrorist attack versus a hurricane versus a financial loss versus an abusive relationship, a divorce. All these things are very different than what they, even if you take just disasters, Katrina versus 9/11, they're very different situations. Or the tsunami in Southeast Asia or the major disaster in Japan. These are all very different situations, and they present us with different challenges. So given regulatory behavior, and if you think about something like meaning making as a regulatory behavior, it may be more adaptive in one context, but less adaptive, possibly even maladaptive in another. Forgive me or maybe indulge me in this. These are some of my favorite slides. I always show these slides. There's no such thing in nature as a perfect adaptation. Every adaptation in nature, every single one, has a cost and a benefit. So the peacock's tail is one of my favorites. I live in New York. It's about sexual selection versus survival techniques. I live in Manhattan, and there are 2 peacocks in my neighborhood. They got a great deal on their part. They have this tail. This is the male. This is about sexual selection. The male peacock has this tail. The peahen does not have a tail like this. And it has one function. The male unfurls that tail, and he says to the female, look at this. And look at it. I mean, it's really nice. It's a really nice tail. And I see those peacocks, and I'm just, endlessly enamored of the tail. And it actually really works. As I said, I've talked to these peacocks, and they'll tell you that it really works. And there's actually, I won't review, but there's good data that shows that it works. Because people study peacocks. They do experiments, and there's all kinds of good data. But this is a bird, and this is a big bird, and a very unmistakable bird. It's got a lot of meat on its body, and there are things on Earth that eat this bird. So they fly, because they're birds. And they don't fly very well, but the bigger the tail, the less well they can fly. So this beautiful sexual selection device has very little say about adaptive fitness. And adaptive fitness takes a hit with a big tail like that. So the cost of that big tail is their greater susceptibility to predation. Another example is the cheetah. And the cheetahs are remarkable. They're super fast. There are 2 cheetahs in New York. They're in the Bronx, not in my neighborhood. They're incredible creatures. They're about this big. They're surprisingly big. They're slender. They're beautiful. They have claws, and they have teeth. And they're ostensibly the fastest creatures on Earth. They look like, they're sleek. They look like the perfect killing machine. But they're not the perfect killing machine, and they can starve because when you're that fast, you have no stamina. So all the creatures that cheetahs like to eat, well, many of the creatures that cheetahs like to eat, have evolved strategies to buy a little time. So the zebra has no stripes. There's lots of theories about why zebras have stripes. But one of the theories is that cheetahs like to pick out the weakling in the herd and go for it. When you've got a bunch of animals in a dusty plain and you've got all those stripes, I guess they're vertical stripes, it's harder to pick out an individual. And they just buy them a few seconds maybe. It might be all they need for the cheetah are going to guess. So there's a cost to everything. And if we bring this back to flexibility to psychology, clearly any one behavior is going to have a cost to it, so it's not always going to be the most optimal choice. Cecilia Chang did this wonderful work beginning in 2001 on coping flexibility. Here's a quote from her. The predominant use of any type of coping strategy can be debilitating. People need to be flexible in the development and deployment of strategies for effective coping with diverse types of situations. We took her idea, we were inspired by that, and in 2004 we developed the next paradigm to measure flexibility and emotional expression. We argued that expression or suppression of emotion is not as important as is the ability to flexibly enhance or suppress emotional expression in accord with situational demands. So the idea that expression is good and suppression is bad, which is very common in the mental health world, is questionable. You can even do it, think about this logically. Too much emotion is maladaptive. We know that lots of emotion, lots of anger, hostility leads to cardiovascular disease, chronic sadness leads to rumination, and depression. By the same token, suppression, inhibition is adaptive at times. You can't really resolve conflict without some kind of inhibition. You actually can't get along with another person without some sort of inhibition. I learned this the hard way with my wife, because I grew up in an Italian family where people were yelling all the time. My father used to yell at the television. He yells at television. My father used to yell at the television. And, I married a woman who is, very, not Italian. Let me just say she's not Italian. And, it took a while for us to work all that out. And really, I think in any relationship, you have to be able to suppress some emotion attacks for the benefit of another human being. And if you're concentrating, anytime you have high task demand, your emotion can get in the way if it's not unchecked. It's not checked. So we published a paper in 2004, we showed that both suppressing, we came up with an experimental paradigm to measure this, both suppressing and expressing emotion are important, and it was the combination of those, the ability to do both, that predicted who we cover well after 9/11. We recently did a study in Journal of Abnormal Psychology showing that people with complicated grief have deficits in expressive flexibility. They have emotion, but they just don't modulate it the same way. And we've done a few other studies in this. Recently, we developed a questionnaire because I wanted to get more at something a little bit more amenable to field studies. So we came up with this idea. It's basically the assumption that historically we've thought about coping with trauma in terms of confronting, processing, finding meaning, etc. But at the same time, there's very interesting literature that shows the advantages of not focusing on the trauma, focusing beyond the trauma. Remaining optimistic, getting involved in activities, taking care of other people, laughing, distracting oneself, etc. In the bereavement world, the Strogians should have the dual process model, which suggests there's two different components similarly in bereavement of restoring, or focusing on the loss, but also restoring one's life. They don't talk about flexibility, but the same two ideas are there. So my colleagues and I basically got a bunch of items together that have to do with this kind of coping, these different kinds of coping. So we're looking for essentially opposite pairs. And we factor analyzed it in a couple different studies, and we found that there were in fact these two clusters of items. One we call trauma focus, which is about focusing on the trauma, and one that we call forward focus, which is about moving beyond the trauma. So these are the trauma focus items. You can see that some of these have to do directly with reflecting upon the meaning, paying attention to the distressful feelings from the event, letting yourself fully experience the emotion, etc. And this is a forward focus item, and these have to do with looking for silver linings, stay focused on the current goals, find activities to keep my mind up, the event, comfort other people, laugh, etc. So these are two distinct kind of approaches. We did this study with Hebrew University students who were recruited for high exposure to character violence. And we validated the scale, so both of these scales were unrelated to trauma exposure, social desirability, so we worried about social desirability, or neuroticism. And they were positively related to ego resiliency, which is a questionnaire measure something associated with flexibility. So that all was good. And they ended up predicting levels of post-traumatic stress, and they interacted with trauma exposure. So this is exposure on the bottom here, and people who were low in trauma focus had a greater, so unable to focus on the trauma. When they needed to, this only measured the ability, they had greater post-traumatic stress at greater levels of exposure. And if they were high in trauma focus, they had less reactivity to the stress. The same thing for the forward focus. People who were low in the ability to move to focus beyond the trauma also didn't do well at higher levels of exposure. The people who were higher in trauma focus did. Forward focus, I'm sorry. And when we combined them into a flexibility score, the prediction got even better. So people who were lower in the ability to do both of these things did quite poorly at higher levels of exposure. The people who were high in flexibility had very little reactivity to exposure. This is a bereavement study in which we, so that study was basically showing the flexibility part. This study began to flesh out the fact that different kinds of pathology might show deficits in one or the other. This was a bereavement study using people from Hong Kong and the US. The results were surprisingly the same in both countries. This study we compared married people with asymptomatic bereavement, so they were basically fine asymptomatic people and people with complicated grief. And you can see the two bereaved groups are the gray groups. They were both higher than the married group in terms of their trauma focus. And they were not different. So even the people who are not grieving are still able to focus on that trauma if they need to or want to. But the difference appeared in the forward focus. The people with complicated grief had much lower scores in the forward focus. So they can actually do the focusing on the trauma. Now, I'm not talking about quality, just doing it, but they were really unable to move beyond. I think sometimes we get a little bit too focused on processing the loss and not getting people moving beyond the event. Finally, this study we did, this is ongoing, I did this with Joe Garacci. We had a group of US soldiers deployed in Afghanistan. And during deployment, they took a scale. And the forward focus scale predicted reduced post-traumatic stress. So while they're facing the difficulties of the constant difficulties of deployment and war, being able to focus beyond, stay focused on what you're doing, not thinking about the stress, not thinking about the event, predicted less post-traumatic stress. And the trauma focus scale, finding meaning, thinking about what's going on, reflecting, actually predicted more post-traumatic stress, and it interacted with exposure. So at higher levels of exposure, trauma focus predicted more post-traumatic stress. So in the context of the stressor, that focusing on that kind of process is not adaptive. Now we're now going to look at what they're like after deployment, and we'll see if there's a difference, a change, and I'm assuming there would be, but this is an empirical question. We've not done anything like this before, so we'll find out. Okay, so I'll sum up and just give you a couple things to take home. So the flexibility idea has a lot of rich implications for the kind of mixed findings you see in meaning making. So I'm going to flesh it out a little bit. This is a preliminary attempt. So there are three components of flexibility. This is a new model I've been working on with my students. Appraisal, repertoire, and feedback. And if we apply these to the meaning-making idea, we could get a little bit of mileage on it, at least summarize it. So appraisal is what happened, how am I coping with it, what needs to be done, etc. We make these assessments of, what do I do? And from a meaning-making perspective, we would say, well, does this ever make sense? Do I need to think about it? Do I need to think about it more? Can I understand it? How and how later? We can ask all kinds of questions about whether I want to or need to think about this in any way. And then, of course, the repertoire of responses. There's so many different things that people could do if they want to or if they think it's appropriate. Talk about it, write about it, think about it, reflect, remember, express it non-verbally, or not do any of those things, distract themselves, keep it off their mind, help others decide not to. And those are really I would argue from a flexibility perspective, the broader repertoire we have, the more flexible we are in dealing with different situations with different demands. And finally, feedback. And we've been working on this for a while, and then Tsukasa Kato, I apologize to her for probably not pronouncing it correctly. We've been corresponding. She's doing some really interesting stuff in Japan with the feedback idea. Asking people how they deal with these things. And so when we choose a way to adapt to an event, we then are benefited by taking stock of what it's doing. Is this adaptive? Is this working? Should I do something else? Should I switch strategy? Should I do this more? Should I not do this at all? And that process is really important because nothing happens in one swoop. We cope with life over time. And so we're constantly paying attention to the feedback and readjusting. There's another broader kind of flexibility, I think that's appropriate. This is Todd Kaskin and Jonathan Rottenberg. I saw Todd somewhere out here. I saw his smiling face. And I like this model a lot. So they argue, and please tell me afterwards how it's got as well. They talk about psychological flexibility as being reflected in a number of dynamic processes that unfold over time. And those processes may involve adapting to fluctuating situational demands, reconfiguring mental resources, shifting perspectives, or balancing competing desires, needs, and life domains. I think that last point's a really interesting point. So just to put this all together, to how we kind of need to think about this, I think, and what we need to do to try to understand these events. And this may be the part where we want to disagree with the most, but I'll put this out there. In order to understand these events, we need to understand the extent that persons might engage in any particular form of meaning control at any time, whether their choice of meaning making depends on how they understand the impinging situational demands, and whether particular forms of meaning construal seem more appropriate or feel more necessary than others, the kinds of cognitive and emotional resources people are capable of using for engaging in meaning making, because not everybody has the same resources to do these kinds of things. We psychologists, or all of you in this room, are very comfortable and well versed with this stuff. We think about it all the time. But not everybody does. But not everybody can. How specific choices about meaning construal influence ongoing adjustment, whether meaning construal may be more appropriate or more effective at different points across time, and finally, whether searching for or finding meaning might be prioritized as more or less important than other facets of a person's experience as the course of their life unfolds. So these are kind of broader questions that we're kind of beginning to figure out, but I think we need to figure out. It's a really big job to try to make sense of all this. And I say to you, good luck. Do you have maybe a little time for questions? Yes?
It seems to me that the way you construe meaning is that you see it as looking back at the event and interpreting it looking backwards. I'm sure there's many ways to construe meaning, including not so much focusing on the past, but saying that happened, now I'm changed, how do I want to live now, and really moving forward, taking it into the future. So I guess the general question for you, what is the meaning of meaning in your thought and your research?
What is the meaning of meaning?
Yeah.
I don't think I can possibly answer that question because if you talk about meaning in the broadest sense, it's just a huge thing. It gets down to what is the meaning of life, And there's usually, I think the point you made is well taken. That there are other kinds of meaning too. I didn't really talk about too many of those other kinds of meaning. I'm really focusing on some, when a really lousy thing happens, when we think about that event in particular. So, for example, we take the worst thing I can think of that just happened was the shooting in movie theaters in Colorado, which is really just a horrible event, really horrible. And if we think about that event, there's a lot of lives that were touched by that event in extremely difficult ways, and so people have to make sense of that somehow. But all those people come into that situation with those broader questions. So I think those questions are kind of the background questions that are always on mind. What does it all mean to me? And Crystal Park had a nice model of global meaning and situational meaning. The model that fits nicely with that idea. So I think there are all kinds of other meanings that are operative all the time. And then we can talk about the specific events. And your point will take it. There are lots and lots of nuances. Yeah.
May I ask you? Hey, George.
Yes, go ahead.
Can you hear me? Have you heard about the famous resource congruence model of coping?
The correct answer is probably yes, but I don't think I can say I
It has been published. It was published by the little guy, Wong, which about the concept of stability. Resource congruence model simply means that to be resilient, to cope effectively, you need to have enough psychological resources and external resources. In order to cope well, you have to be flexible to match your resource with the situation. Different situations call for different responses, so if you have the repertoire and resources and able to match the situation flexibly, then you'll be resilient. So I proposed that theory in 1985. It was published then in the unknown psychologist, Canadian Psychological Journal. You Americans don't read in journal, right? But this guy is comfortable in the journal. So that's the concept.
Let me, if I think I'm guessing what the question was. but that I would suggest that there are other things. I think that makes perfect sense to me.
It's a concept of ability.
But you can also think of resources in terms of non-person things as well, or things that the context in which we live. That I don't know if you meant that for resources for
The
coding.
resource means that for the ability to be flexible, you need to have enough resources in order to match the situation appropriately. So you require both resources and critical thinking, open-mindedness to choose the resources to suit the situation. So that's ability, right? So now you create another concept, the important concept of ability is back to, but basically talk about the ability to be flexible in response to the situation. That's what it is, right? You be flexible to respond to the demand of the situation.
Yeah, I would, yeah.
So that's what you come and say. So sometimes the new concept is recycling of old concept. Sorry about that.
Thank you. Would anybody else like to take a shot? Any other questions? No, there's one. Do we have time for a question?
Just quick.
Okay, 30
I'm
seconds.
just curious if when you look at the changes that happened in divorce specifically, I'm curious about when you looked at the differences that happen with divorce and you split it up into men and women. Because I know there is a big differentiation between the sexes in that.
There wasn't the question about, there wasn't a huge differentiation in sexes in that. There was a big sample we didn't know. Gender are small effects, and so there wasn't a whole lot. Now, in some other situations, for example, we just did a study of how people react to pregnancy and the birth of a child. And there was a big difference, gender difference there. But yeah, there really wasn't that much of a difference in divorce. Yeah, it's interesting. We didn't probe that much further, but anyway, apparently we stopped, so thank you.
Kingwell will be starting in a couple